the bad boy of fertility. His practice is one of the most successful IVF clinics. He has pushed the boundaries of fertility and is a hero to many. Our guest today is Dr. Muhammad Taranissi. Dr. Taranissi, you're Britain's most successful IVF specialist. Your clinic, ARGC, has topped the league tables every year. You have clashed repeatedly with the Human Fertilization and Embryology Authority. And despite the controversies, your clinic is where dreams come true. Welcome to our show.
Pleasure, thank you.
It's been I know how busy you are, and I know you work round the clock. So I really, really sincerely am very grateful that you took the time out to come here and discuss the very important issue of fertility.
It's my pleasure.
You've been called the miracle maker. How do you feel about your celebrity status in the world of IVF?
I don't know. I mean, I never really see it in this way because I'm quite focused on what I do and so on. I think celebrity is a very big word because I'm just a doctor. I'm just trying to do what I believe I'm capable of doing, and hopefully along the lines we try and help a few people and continue to do so for as long as we can.
But miracle is a big word too.
I'm not quite sure you can describe it as a miracle. I think it's just something that is just what nature meant people to have, and you just try and help them along the lines, and some people sometimes may have simple problems that are not that complicated to deal with. Some other people, because a lot of our patients are people who have failed repeatedly elsewhere.
Yes.
And that's why maybe when they are successful with us, maybe people can describe it as a miracle or whatever, but most of the time it's down to maybe doing things in a different way, maybe identifying problems that probably people didn't see before. So it's a lot of hard work, and most of the time if you put the effort, I think you get the result as well.
Now, you studied in Egypt.
Yeah.
You're Egyptian. Then you came to the UK to study here.
Yeah.
Why the field of fertility? Because it's a very challenging field.
Well, it's a complicated story because it didn't really start like this. I think when I was training, I used to do a lot of obstetrics, and this is something that I really enjoyed a lot, which was dealing with babies at the time of birth, and you could see the joy it brings to families and stuff like that. And I've done a lot of that in my earlier years as a doctor. And then funny enough, when I decided to go into subspecialty, I actually trained as an oncologist.
Really?
Yeah, I trained as a gynae oncologist, doing all those kind of radical surgery for cancer cervix, cancer parts of the gynecological organs and stuff like that. But I just didn't feel that I can continue my career in this field because it was quite depressing, to be very honest with you, because you always...
Is it because of the patients you lost?
Well, yeah, I think if you compare maybe fertility to cancer treatment, I think the progress in cancer treatment over the last, I would say, 30, 40 years hasn't been that much.
And because also uterine cancer and cervical cancer, these are cancers that are quite aggressive.
Yeah, I mean, it's a very difficult situation most of the time, and also again, a lot of the cases by the time they are diagnosed, I mean, they are at a late stage, and a lot of the things that you can just offer them is what we call a palliative treatment, just to try and ease the problems and so on for 3, 4, 5 years.
Damage control.
Yeah, so it wasn't something that I felt I can continue to do as a career.
So, Dr. Taranissi, not everyone knows what IVF is. So, in simple terms, what is IVF?
Well, I think IVF now, because it's been around for I would say now 33, 34 years, I think a lot of patients or a lot of people now have known friends or members of family who've done this treatment. So essentially what you're trying to do is create embryos outside the body, which is something that is meant to happen inside the body and hopefully grow into a baby and so on. Some people cannot do this on their own. They may need some assistance for a variety of reasons. I mean, some people may have an obstruction in the tube, so effectively their eggs cannot be fertilized by the sperm because they can never get together into the body. So this is how IVF started, just to try and take the eggs outside the body, fertilize them with the sperm, and put them back into the uterus. So that's the simplest way of looking at it. And then it just developed into covering all sorts of other problems over the years. I mean, problems like sperm issues, which until 10, 12 years ago were very difficult to handle. Nowadays it's a standard treatment. You can offer a lot of things to people, and so on and so forth. So it is an expanding field.
Your clinic, ARGC,
Yeah.
it is the most successful in Britain. It has topped league tables every year. Your clinic's birth rate is nearly double compared to other clinics. What is the reason for this success?
I don't know. I've probably been asked this question like many times, and I really don't know. I think we've all...
You think outside the box?
Well, I think,
You
yeah,
push boundaries?
you can say that. I mean, we try and always keep an open mind about things, and because most of the cases that we see are very challenging, they've already been treated in the standard way, so there's no point trying again, just doing standard treatment for them. You have to see whether there are any other ways of dealing with their problems and so on. We work 7 days a week, and that's true. I mean, we don't work like sort of Monday to Friday, 9 to 5 and stuff like that. We try and do what we think is right for the patient at the right time in their cycles and so on. And it's not down to one person. It's always a team effort. I mean, we've got a lot of people who work very hard at the clinic and continue to provide good results.
But Dr. Taranissi, women who fail in all the other IVF clinics, who have amazing doctors, who are doing very well in fertility, they come to your clinic and most of them are successful. So you must be doing something that they are missing.
Well, I mean, as I said, I mean, one of the things that we've been doing probably in the last 10 years at least is looking beyond the embryos, because a lot of the IVF work is focused on creating good embryos, selecting good embryos to go back. But in my mind, good embryos is half the story. You still need to put them in what we describe as the right environment. If the environment is not good for the embryos, regardless of whether they're good or bad, they're not going to grow. And this is still a very gray area in medicine, and there's a lot of controversy and there's a lot of debate about it. But we went into this 10, 11 years ago, and we've continued to improve and modify how we deal with this particular problem. And I believe this has made a big difference.
It's a competitive field. Some doctors are not so keen on your methods, and some doctors feel that your methods are very controversial. Are your methods controversial, Dr. Taranissi?
I don't really, it doesn't matter whether they're controversial as long as they produce results. If you were a patient and you're coming and you've struggled years and spent tens of thousands of pounds and you've never had a baby or even a positive test, I mean, when you come and we treat you in a certain way and you have a result, would you really bother whether it's described as controversial or not?
But then why are those doctors calling it controversial? Are they wrong? Are those methods wrong?
I don't think they are wrong because, like you just said, I mean, we've always had very good results, and our results have always been way above most other people. So they are working, and it's not an imagination or anything like that, because the figures speak for themselves.
Is it because you push boundaries they wouldn't dare to push?
I don't know. A lot of it is a lot of effort as well, and it's not a cliche, because to work 7 days a week and communicate with the patient on a daily basis.
I'm just wondering how you're still married after working 7 days a week, 365 days a year.
Still going.
That's a big commitment, Dr. Taranissi.
I know.
Infertility, it has a very emotional impact on the woman and also on the couples.
Yeah.
And some of them get very desperate to conceive. How do you deal with the emotional pressure of getting a positive result for them?
It's very, very difficult, and this is actually a very important part of the treatment. It's not just the medical side of it. There's a psychological issue, there's a financial issue, and it's not just something that affects the woman or the husband. It affects the family as well, because I had many letters from the parents of the couple when they are successful, telling us how their life has changed and how now they've got their grandchildren and all the rest of it. So it's a very important, it's a human nature. I mean, everybody would like to have children and have family and stuff like that. And a lot of the patients sometimes that we see lately are people who are achieved almost everything in their life, and they're very successful in their career and so on. And this is the one area that they really struggle to achieve.
But somehow this is sometimes, well, for most people, this is the most important area of their lives.
It is, and it's a combination of many things. I mean, a lot of people sometimes leave it till a little bit late to try and just start a family, thinking that, okay, they will always get what they want, and there will always be something or some treatment that they can resort to try and help them and so on. And it's not as simple as that, because the earlier you start, if you have a problem, the better the results. It's just the way it is. It's not an illness, because every woman is born with a set number of eggs that she uses over the years, and she uses her best eggs in her earlier years and so on. So if you have a problem and you try early, then your chances are going to be much, much better.
Like you said, it's not an illness, but it is a taboo in many cultures, and especially in the Asian culture. If you're infertile, it's a taboo.
It's everywhere. I think from what I've seen, it's not just in our part of the world or whatever. I think it's here as well. And it's just something that people find it sometimes very hard to cope with. And it can affect their life. It can take over their life completely. And some couples, sometimes they end up sort of separating and stuff like that if things are not working for them.
Is it women who take it, well, I'm sure both the couple is affected, but is it worse for women?
I think it is probably more affecting the female side than the male side, but it can equally be a big problem if the reason for the infertility is actually on the man's side.
Yeah.
I mean, it could change people and make them sometimes very, I don't know.
Angry?
Angry, yes. Yes, I've seen this as well. I mean, I remember very clearly in our very early days of starting the clinic and so on, we had a couple who came to us. They were a young couple, and they had already like 3 failed attempts elsewhere. And the man on the day of his first consultation was very, very stressed, very aggressive, almost kind of shouting at every person and all the rest of it. And they had treatment with us and they were successful. And they came with the child to show to everybody. And it's like you're looking at a different person, completely different. Very calm, very relaxed, very this and that. They actually had 3 children after that, those couple.
Do you feel that human beings feel incomplete if they feel they can't?
Yeah, I think it is possible. It's as I said, it's a human instinct. I mean, everybody would like to have a child, and it's sometimes difficult when you cannot achieve this and you're surrounded by friends and other people from the family.
And of course, it's someone's birthday or it's someone's play date, and their children all around you, and all the conversation generally tends to be around your children. It's
a very sensitive issue, and that's why when you try and deal with it, it's not just the medical side. You need to make sure that you also cover this aspect of it. It's very, very important. And I think the way I look at it, because people who come to us, if they are not successful with us, it's very difficult for them to take, because they come to us as a last resort and they think, okay, we're going to get them pregnant and so on. So it is very, very difficult. And it put pressure on us as well. And it's stressful for us and for the team and for the clinic.
To get a positive result.
It is very difficult.
Is it a common misconception that infertility is a woman's shortcoming, and most women feel crippled by the burden of being infertile, whereas male fertility accounts to 40 to 50% of infertility amongst humans?
Well, the causes of infertility are kind of equal across sort of male and female. So.
But why does a woman bear the burden? Is it ignorance?
It's not that. Maybe just like sort of over the years, this is how it evolved and how people sort of thought of it. But treating male infertility is probably a little bit easier than dealing with female infertility, because all what you need is to find a good sperm to go into the eggs. And most of the time you can do that. Because even if there is a problem with the sperm and there is a low count or low motility, you only need one sperm. So you can pick up one and make sure that it goes into the right egg and so on. The problem with the woman is a little bit different, because if they stop producing good eggs, it's very tricky, because they only produce one egg naturally, and if you push them by drugs, there is a limit to how many eggs you're going to get out of them, and some of the eggs may not be good, may not be easy to use, and so on. So it's a bigger hurdle to overcome.
Some people feel that IVF is not natural and against the preachings of their religion. You're a Muslim, Does IVF work against Islamic principles, you feel?
Not standard IVF, but you can argue if you're talking about things like egg donation, sperm donation, embryo donation. This is when you get into really the issue of religion and whether this is right or wrong and so on. But just standard IVF, where you take the eggs from the wife and fertilize them with the husband's sperm and create an embryo that is genetically their child and put it back into the woman's uterus, I cannot see an issue with that at all.
Dr. Taranissi, there's also a debate in the world of fertility about multiple embryos. Obviously, when you do IVF, you don't just fertilize one egg. You fertilize quite a few eggs. And then you implant one or two embryos. The rest are either frozen or destroyed. Are destroyed embryos not life form killed?
I mean, we don't actually destroy embryos. You don't freeze embryos that are not strong enough to develop and hopefully give you the potential of having a baby. And that's no different from what happens actually in nature, because when people try naturally, they produce embryos naturally that are not strong enough to implant and give you a baby, and they just perish in the body. So that's the same process. The only difference is that when this is happening in the body, you actually don't see it. Whereas in the lab, yes, you can see that an embryo has arrested, it didn't divide beyond the number of cells, and it's not viable.
So Dr. Taranissi, you fertilize a few eggs. You implant one or two. The rest you freeze forever?
If they're good enough, you freeze them, and essentially this is for the couple to use it at another time. If they're not successful with the fresh cycle, they can come back and try again with some of those embryos instead of doing the whole treatment again, which is a much simpler way of doing things. If they are successful and they want a sibling to the child, then they come back and can use them again. And most people, the vast majority by far, will use their frozen embryos over the years. And you have to remember also that when you create embryos and freeze them when the woman is younger, and when she comes back 2-3 years later having had a child or maybe two, I mean, she still have a much better chance using her frozen embryos that were created when she was young than actually trying again with her fresh eggs when she's a few years older.
So Dr. Taranissi, when an embryo is made, do you feel that that's alive?
Yes, I do. But it is alive that either is going to be used as fresh to hopefully give rise to a child, or still going to be used at a later date also to give rise to a child. That's how I look at it.
But some religions believe that it's not a child till the heartbeat isn't there, which is after 40 days.
I don't know. I mean, you can argue differently for eternity about where is the cutoff point and so on. But I believe once we fertilize the egg and we created an embryo, this is sort of a human being in waiting. And if it's got the full potential and it's put in the right environment, there's no reason why it cannot be a child and an adult at a later date. So it's something that you have to really, really think about it very seriously. It's not something that you should approach lightly or casually or anything like that. I don't.
Dr. Taranissi, while your clinic is extremely successful, yet it's been written that your approach is very aggressive. Do you push against the boundaries of ethical treatment?
I don't know. I mean, I don't think we've ever pushed against something that is ethically wrong, because I look at this very, very seriously. And I mean, some of the controversy that happened, particularly in the earlier years, were about a misconception about what you're actually trying to achieve. I mean, one of the things that we introduced to this country way back was what was described in the media as savior siblings and spare part babies.
Are you talking about PGD?
Yeah.
You were the first in Britain to perform PGD, which is pre-implantation genetic diagnosis of an embryo. Tell us a little about PGD.
It wasn't exactly that. What we actually did before anybody else was two things. One of them was checking embryos for chromosomal abnormalities that can lead to miscarriage. And this is what they call pre-implantation genetic screening. So the idea was to try and make sure, instead of just choosing embryos based on how they look under the microscope, if you can add to this an additional test that tells you that also the chromosomes are normal, you increase the chances of success rates by doing that. That was
So
how we
basically,
looked at it.
the abnormal embryos are terminated.
Yeah, I mean, you don't use them.
Yeah.
Because, I mean, if there is an extra chromosome or a missing chromosome or something like that, either they're not going to implant.
So what's wrong with that?
But you don't want to go through a treatment and have a failed cycle if you can avoid that.
No, what I'm trying to say is that what you were suggesting
Yeah.
could only benefit couples
Yeah.
and the human race,
Yeah.
because to be honest, no one wants to be born deformed,
Yeah.
and no one wants to suffer abnormalities throughout
Yeah.
their lives.
Yeah.
So what you were really doing was a service to humanity. So how come there was resistance against PGD?
I think that the resistance was essentially about, because it's an invasive test, because you have to remove a cell out of the embryo and whether this can actually damage the embryo and stuff like that. But most of the work and the studies that have been done didn't show that this was actually in any way affecting the development of the embryos and stuff like that. Because you only remove one cell, and at this very early stage of the embryo development, the embryo has got the potential to multiply and actually replace the cells by other cells.
Is that cell put back, or you just once it's taken out, it's taken out?
No, it's taken out and it has to be assessed, and it's never going to be put back again. So this was kind of a theoretical worry. The other issue that we also implemented was checking the embryos for what was described as a tissue match for an affected child in the family.
Yes.
And the idea was to try and find an embryo that is going to be identical to the child affected. And at the time of birth of this new child, you can actually use the stem cells in the umbilical cord to cure the affected child. But I think there's a lot of misconception, because people thought that you're just going to create a child and then at the time of birth you're going to take a part of this child to cure someone else and then dump this child somewhere. But this wasn't the case. And even at the height of the controversy, whenever I was asked to explain and discuss this, and once you've explained it and showed to people that actually the child that is going to be born will be loved and cherished because he's another part of the family, and all what you take is the umbilical cord, which is normally wasted.
Thrown away with the placenta.
Yeah, that's exactly what we do. And
So
once
why
people,
is there...
No, but once you've explained it to people and they understood that, there was no issue. It's just the way it was portrayed in the media and sort of the way it was sensational headlines and stuff like that. There was a lot of debate about it, a huge debate. And also because the HFEA used to sit on the fence on all these decisions. They were very, very kind of...
Conservative?
Very conservative. They're like really... I mean, and I've said this before.
But why weren't the other doctors pushing for it? There are so many fertility doctors and so many fertility clinics in London. Yet I feel that you were the one who was pushing boundaries and creating new technologies.
I don't think I'm the only one. I'm sure there were other people who probably shared similar views and so on, but maybe I've just went the full distance with it rather than just talk about it in a meeting or something.
Now, your clinic was the first to freeze and thaw eggs.
Yeah.
Are frozen embryos better than fresh embryos?
They're not better, because fresh is always better than frozen. But if you are selective or sort of about which embryo you're going to freeze, you can still have a very good success rate with them.
But it's also said that frozen embryos are probably better because once they've thawed, if they are still active and they're okay, then it shows that they're more resilient than a fresh embryo.
You can say that as well. That's why it comes to the point that I was just saying, that you don't just freeze any excess embryos. You only freeze the ones that have shown some potential, developed up to a certain point. We never freeze embryos for the last, I would say, 10 years unless they develop to what we call a blastocyst stage, which is the maximum stage of development that the embryo can continue to grow into the laboratory.
And what's that stage?
It's just, I mean, normally when the embryo fertilized, when you look at them the very first day, they are made of like 2 cells and then 4 cells and then 8 cells and so on.
What's the cutoff point before they have to be implanted into a uterus?
There's no cutoff point. I mean, some people, in the early days of IVF, they used to put the embryos straight away after fertilization because you didn't have the capability of growing them into the lab for a few more days. So this has improved over the years, and now you can keep an embryo into the lab 5-6 days. But that's as far as you can take it in the laboratory.
Okay.
And if you have an embryo that has continued to grow to day 5 and day 6 as you expect it to grow, then it has shown that it's got the potential, and if you freeze those embryos, you're more likely to be able to use them at a later date. Whereas if you freeze early, like on day 1 or day 2,
Yes.
you don't really know the full potential of the embryos. And you
Yes.
may find out that the wastage is much higher out of those embryos.
Now, you've sometimes also been criticized for.
I've always been criticized.
You've always been.
Yeah,
You're like the bad boy of fertility.
I know.
What's going on?
I don't mind that. That's no problem for me.
You've sometimes been criticized for using immunological treatments.
Yeah.
What are they, and what is their relation to natural killer cells?
Yeah, but this is what I've referred to earlier. This is just a way to try and make sure that the body, where the embryos are going to go back, is prepared to look after the embryos.
Yes.
Because a good embryo without a good environment is not going to make it.
Yes.
And this is what's been described as immunological treatment and investigations and so on, because a lot of the problem that happens with implantation is to do with some immunological condition, how the body reacts to a foreign body, which is the embryo coming into the uterus and so on. And some people have such high activity of a variety of mechanisms that can actually attack the embryos, even if the embryo is very good, damage the embryos and stop the embryo from implanting, or if the embryo implant, it may not be able to go the full distance to.
So your
9
body
months.
thinks that you have a foreign,
Yeah.
like that you have a virus,
Yeah.
and it's going to attack it and destroy
Yeah,
it.
it destroy it. So you try and do something about this. And I mean, if you look at the reasons of infertility, traditional sort of teaching, they used to tell you roughly 30% female, so 30% male, 30% maybe combined, and 10% unexplained infertility, meaning that nobody knows what is the problem. For those labeled earlier as unexplained infertility, from our experience,
Yes.
the vast majority of them have a problem in what we call implantation, how the body actually deal with the embryos that are put at the end of the IVF treatment.
So you have to prepare the uterus.
It's not just the uterus, it's the body as a whole. As it's a very complicated mechanism because many things come into play, including blood supply, including the activity of certain cells that are meant to be around the site of implantation to facilitate the implantation process and so on. So you try and deal with those problems and make sure that the environment is right. So hopefully, by the time an embryo goes back, and actually this can happen without even IVF, because some people, their only problem...
They constantly miscarry.
Yeah, but when they get pregnant, you still need to monitor them, because all these mechanisms can change and you need to monitor them, adjust your medication and so on. So most patients who have treatment with us, if they are pregnant, we actually monitor them throughout most of the pregnancy, which I would say no other clinic does.
No, they don't.
No, once you're pregnant, that's okay, thank you very much, and end of story.
So, Dr. Taranissi, you are working very hard, and you are obviously researching new areas and finding new ways of trying to give, make every woman's dream come true, i.e. create a child for them. Why is it that the HFEA constantly...
I think they stopped now.
They've stopped now.
Yeah,
they stopped after the big drama in 2007.
I don't know. I mean, I guess like anything in life, I mean, there are sometimes, I don't know.
But you have been defying rules for the HFEA, and you've been quite a maverick. And
but a lot of the things that we challenge the HFEA on them, they're now kind of established practice in the country. Meaning that, okay, we were not really kind of like crazy or daydreaming or anything like that. They seem to have been accepted and established nowadays and so on.
But you successfully sued the BBC
Right,
for a defaming documentary that was made about your clinic on Panorama.
Yeah.
And it was a £1 million libel case.
Yeah.
And you won. You received £500,000. Why is the establishment working against you?
Actually, you received £1 million.
You did receive oh, okay.
That's okay.
Do we plan a trip?
Well, I mean, I don't know. It's not something that I go out of my way to try and just really fight with people, but sometimes you just have to really stand up for, not just for myself, it's for the people who work with us, the patients who have come to us and believed in what we do and so on.
Your patients actually opened a website, Friends of ARGC, and they really stood up for you.
It was actually, this is one of the things that make you think that what you're doing must mean something for people. And I was really, really surprised because within one day or something like that, when we had all this drama about us, the number of emails and letters that we had, and they were not just like a letter that is a 2-line letter or whatever, which is like kind of people trying to tell you thank you and so on. They were like 2 pages letter and 3 pages, meaning somebody really believed in all of this to write and elaborate that much and write to the HFEA and write to all sorts of people. I just really felt that you cannot just let this drop without you actually standing up and trying to show to people that what we're doing, we believe in it and it's right and it helps a lot of people. But what I also said equally that I was fortunate enough to be able to do this because it's a very, very sort of expensive exercise. It costs a lot of money. And if you don't have the money, you cannot really do that, which is sad because the system shouldn't be like this.
Yes.
And if we didn't have the money to stand up and fight those cases, we probably would have, who knows what would have happened.
But does the HFEA have something personal against you? I mean, they raided your offices in 2007. Their claims were later disqualified. So basically, they didn't really have a leg to stand on.
I know.
So why the fuss?
It is sad because it shouldn't be like this. It shouldn't be like this. You may have issues with a person, but you may dislike somebody or whatever, but it shouldn't really be personal, particularly if you are in a position of power. If you are in a position of power
But why aren't they celebrating you?
I don't know. I have no idea. I mean, I had a letter on just before Christmas this year, actually an email from the chief executive of the HFEA. He forwarded to me a letter that they've received from a patient. She wrote to the chair of the HFEA saying that she's a medical person herself, and her husband, I think, is a medical person. They had 2 or 3 goes somewhere else locally before coming to us.
Yes.
And then they came to us, had treatment with all these new things that people say are controversial and there's no evidence and this and this and this. Got pregnant. She actually got pregnant twice. So she had 2 kids now. And she wrote to the HFEA saying to them, why are you not looking at those methods? I mean, you are the governing body, and this clinic has shown that it has achieved results over X number of years. And actually, you ought to look into this because
actually, there was a time when they refused to even publish your results.
I know, but as I said, it was all kind of, there was an element of a personal issue into it, but I don't want to really think like this. I think it's history now, and I just hope that everybody can just turn the page and just move on.
We'll go for a short break. See you in a bit.